Hi everyone, my name's Carrie and today I'm going to demonstrate for you how to properly dress a wound. This is important for me because I'm a nurse, so I do this multiple times a day, but it's also important for you because if you have kids or a family and something happens and you want to be able to make sure that the wound is clean and taken care of properly so bad things don't happen. So the first thing we're going to do is I'm going to explain what I have here. I have normal saline, an ABD pad, some gauze, triple antibiotic ointment, which is just regular Neosporin, some Kerlix to wrap it with. I have tape to secure the Kerlix and gloves and hand sanitizer. Obviously you want to wash your hands before you touch anybody's wounds and after. So we're going to start. I'm going to sanitize my hands. So the wound is going to be right here on Delia's arm. I'm going to put gloves on. So the first thing I'm going to do is assess the wound and make sure there's no dirt in there, that it doesn't look infected, that she doesn't need to seek any further attention than just me right now cleaning it and dressing it for her. So now I'm going to open up the normal saline. I'm going to take a couple of gauze pads, get it damp with the normal saline. I'm going to clean the wound by patting it. You don't want to rub it or scratch it because obviously that will hurt the person that you are cleaning the wound on. Then we're going to throw it in the trash. I'm going to take a couple of more gauze pads. These are all sterile gauze pads. We're just going to pat it dry. And again, I'm just checking to make sure I got any debris out of the wound. Next thing I'm going to do is apply the antibiotic ointment. I'm going to use a sterile tongue depressor to do that. Obviously, if you're at home, you're probably not going to have a sterile tongue depressor, so making sure you're doing it with clean hands is okay to do. I'm going to apply the triple antibiotic ointment, just a thin layer covering the wound. You don't want to soak it too much. I'm going to open up the ABD pad. Get this ready. I'm going to apply the ABD pad over the wound. Obviously, if the wound is smaller, you don't need to use something this large. If it's a small wound, you can use a Band-Aid. That's a sterile covering for it. Even just gauze, but gauze may stick to the wound if it's open. I'm going to wrap it with the Kerlix to secure it because you don't want to put tape on. Everybody's skin cannot tolerate tape, especially if the person has fragile skin. You definitely do not want to put tape on it. Wrapping it with Kerlix or gauze or whatever kind of fabric wrap you have at home would be appropriate. Okay, you want to make sure it's as flat as you can get it. Now we're going to put our tape to secure the bandage. Okay, make sure the edges are good. All right, and now we're going to clean everything up. We're going to make sure we dispose of it properly. Into the trash. I'm going to take my gloves off and make sure we are properly washing or sanitizing our hands. So that is how you can properly dress a wound. Thanks for watching.
So I just want to make sure I point out how important it is to seek proper medical attention if you think a wound is infected to avoid a delay in treatment. Some signs and symptoms of infection are redness and swelling around the wound, increased pain, increased drainage, and oozing from the wound, and fever can all be signs that need to be reported to your medical provider as soon as possible. Thanks for watching my demonstration on wound care.